Hello guys, welcome back to A to Z Dentistry, a channel which features easy explanation of various dental and medical related topics. And our today's topic is civet bodies. So without any further delay, let's get started. So under civet bodies, today we will be studying it under the following headings: introduction, definition, appearance, histology, pathogenesis, various conditions which are associated with civet bodies, and finally the conclusion. Chalo, so let's move on to the introduction for civet bodies, right? So basically these are your apoptotic keratinocytes. मतलब ये वो keratinocytes है who have undergone a programmed cell death, right? And they appear eosinophilic, hyaline, and these are round. Okay, so these are your round structures, and these are usually found in the dermo-epidermo junction. Okay. So histopathologically, they are obviously a feature of interface dermatitis because of their location itself, and they are characterized by a immune mediated damage. So now these are found only where there is an autoimmune disease involved. Okay, so your buzzword here is immune mediated damage. Now this immune mediated damage forces these basal keratinocytes to undergo programmed cell death. Okay, and these bodies are then commonly seen in conditions like lichen planus, lupus erythematosus, graft versus host disease, and lichenoid drug eruptions. Why? Because here you can see a pattern of immune mediated damage. Right? There are some antibodies which are causing direct damage to the basal keratinocytes, as a result of which they are undergoing a programmed cell death, leading to the formation of your civet bodies. So their presence is basically an indicative feature of keratinocyte apoptosis due to cytotoxic T cell activity, right? As I have told you previously. So these leads to a degeneration, which is the hydropic type of degeneration. Very important point, right? So there is a hydropic type of degeneration of the basal layer itself. Okay, so the basal keratinocytes are undergoing hydropic degeneration due to cytotoxic T cell activities. Now the civet bodies are usually a diagnostic marker to identify various dermopathological conditions, right? Particularly, it is very helpful to rule out autoimmune disease as well as some types of inflammatory skin diseases. Now the diseases which we have discussed previously, particularly your lichen planus, lupus erythematosus, lichenoid drug eruptions, so these are the diseases whose manifestations are common in the oral cavity, but also these are your systemic diseases, right? So they will affect the body as a whole. So now let's move on and discuss the appearance of civet bodies, right? So as I have said that these are visible only under the microscope, that is histopathological phenomenon, right? So we'll look at the microscopic structure. Okay, so basically these are round or oval eosinophilic bodies. Okay, so ये round shape की होती है, eosinophilic होती है, right? और ये आपको कहाँ दिखेंगी? ये आपको basal layer पे दिखेगी, within the basal layer of the epidermis or at the level of your papillary dermis. अब इनका जो size है it may vary, right? कुछ आपको बहुत ज़्यादा श्रंकन दिख सकती है, मुरझाई हुई, एंड अदर्स माइट अपियर एज फ्रेगमेंटेड बॉडीज. ओके, सो ऑफकोर्स ये आपको डर्मो एपिडर्मो जंक्शन पर भी दिखेगी, एट द सेम टाइम ये आपको बेजल लेयर के लेवल पे भी दिख सकती है. वाई? बिकॉज दीज आर द बेजल केराटिनोसाइट्स विच आर अंडरगोइंग apoptotic टाइप ऑफ सेल डेथ. So now let's take a look at this picture. I'm gonna zoom it. So here you can appreciate your civet bodies. Okay, so यहाँ आप देख सकते हैं these are ovoid to round in structure, spherical in structure. Okay, these are stained pink. Okay, these dark pink structures, eosinophilic structures, these are nothing but your civet bodies. Also note, see, some appear as quite fragmented and others appear quite shrunken. Okay, so this is your shrunken structure, and here these are your fragmented ones, right? So under microscope you can appreciate such appearance, particularly at your dermo-epidermo junction. So now again we have one more picture depicting your morphological features of your civet bodies. Okay, so here you can appreciate, right, these are bright pink. Okay, also they are quite hyaline like. Okay, that is translucent appearance is there. Here you can appreciate these are your civet bodies or your dead keratinocytes. See, you can appreciate the hyaline like material, the eosinophilic structure, and the globular, spherical or In some cases, an ovoid appearance may also be seen. So this is the appearance of civet bodies under direct immunofluorescence, right? So this condition here is nothing but your lichen planus, right? As it is an autoimmune disorder, so I have taken this. So here you can see there is a deposition of your immunoglobulins, right? So particularly IgM type of immunoglobulin is very predominant here. Also you can appreciate another marker, that is C3. Okay, but also remember there is a hallmark for lichen planus, that is deposition, that is an irregular type of deposition of fibrinogen along the basement membrane. So here you are appreciating the same thing. Okay, there is a deposition of fibrinogen along the basement membrane along with your colloid bodies. Now these colloid bodies, as discussed previously, are nothing but your civet bodies. Okay, so these can also be found along the basement membrane in clusters particularly. I hope in this picture also you can appreciate it. There is a vacuolar type of degeneration occurring and this whole membrane is stained with your fibrinogen. Okay, so along with your IgG, also IgM deposits are seen along the basement membrane and C3, and particularly these markers are very pronounced at the dermo-epidermo junction. Very important point here. Also note that an MCQ can be asked on the same thing, right? Which type of immunoglobulins are involved? Two. First is IgM, second is IgG. Also you can see deposits of C3, and the most prominent marker particularly in case of lichen planus would be staining of the fibrinogen, especially along the basement membrane. So in this slide again I have put up some pictures in order to show you the basal cell degeneration and the civet bodies again. Okay, so here you can see there is a basal cell degeneration occurring. Very clearly you can see, right? There is a degeneration of all the basal cells happening over here and some appear as distorted. Why? Because it is autoimmune disorder. Okay, so there is attack by the antibodies. Because of this the basal membrane is completely destroyed. Okay, there is a morphological destruction of your basement membrane occurring and the basal keratinocytes are undergoing degeneration. What type of degeneration is seen? Hydropic degeneration, right? Which means they will take up water, they will swell up, and this will result in distortion of their normal morphological appearance. Okay, and as a result they will undergo apoptosis or the programmed cell death. Okay, here again same picture you can appreciate, right? These are your basal keratinocytes which appear detached from your basement membrane. They are free floating, and after this free floating phase they tend to converge near your dermo-epidermo junction. Okay, so these are eosinophilic, right, translucent, hyaline like, and predominantly present over your dermo-epidermo junction. So here in this slide we are going to see two particular conditions associated with civet bodies, but also there are some predominant microscopical findings apart from your civet bodies, right? So here you can see there is a lymphocytic infiltration occurring, right? See, this is your hypergranulosis over here, then these are your civet bodies or the colloid bodies in the basal layer itself, and just below that you can appreciate the lymphocytic infiltration, right? Now this is the case of lichenoid reaction. Okay, this is not lichen planus, this is your lichenoid reaction, and as you can guess, lymphocytic infiltration occurs in chronic type of disorders, as lymphocyte itself is a marker of a chronic disease. So in cases of lichenoid reaction you can appreciate such a picture, right? There is hypergranulosis present of civet bodies along with lymphocytic infiltration. Our next condition is lichen planus, right? So here you can appreciate a predominant cleft at the dermo-epidermo junction, and also there are some melanin leaden cells which are present over here, and these are your colloid bodies or your civet bodies which are present in the papillary dermis itself. Okay, as discussed previously. Now let's discuss the pathogenesis for your civet bodies. Okay, so as we have mentioned previously also in the definition itself, we have seen that these are your basal keratinocytes undergoing programmed type of cell death which is immune mediated, right? And this is pronounced at your dermo-epidermo junction. So basically these are markers of your interface dermatitis. Okay, so there are certain triggers which can lead to formation of civet bodies. First is obviously your autoimmune disorders or presence of certain inflammatory triggers, right? So conditions such as lichen planus, lichenoid reaction, lupus erythematosus, anything which can trigger your T cell mediated cytotoxicity can lead to formation of your colloid bodies. Okay, so lichen planus, lupus erythematosus, all these conditions, the common factor is there is a cytotoxicity which is due to your T cells, right? So T cell mediated cytotoxicity which is ultimately causing the destruction of your basal layer of keratinocytes, leading to formation of your colloid bodies. Then if at all there is a basal cell damage, now what happens once these T cells are triggered, particularly your CD8 plus T cells, this go and directly attack your basal keratinocytes, right? And once they are attacked, they undergo apoptosis. Yes, so your next step would be there is cytoplasmic degeneration. Okay, so what happens once your keratinocytes are damaged, there is a hydropic degeneration, as I have told you previously. Now what happens, the cells take up the surrounding water, they swell up. Now once they swell up, they have lost their normal morphological features, right? There is loss of the structural integrity of the basal layer. See here, you can appreciate, right? So these are your apoptotic keratinocytes, they have swollen up, taken up all the water. This leads to loss of integrity at the level of your basal keratinocytes, and naturally then there is distortion of the basal layer itself, and ultimately these get free floating after a point of time because the junction is lost, right? The integrity is lost, they are away from each other, and ultimately they will leave this basal layer and get clustered towards the dermo-epidermo junction. Okay, then last step would be the formation of civet bodies, right? So then these apoptotic keratinocytes eventually become eosinophilic, round to ovoid. As time passes further, they become hyalinized, a slight translucent they become, and then they are engulfed by the macrophages itself, right? So this is one fate, either the macrophages will come and consume them or they will be cleared by your immune system. But the main point here is that their presence itself can help you distinguish many autoimmune mediated disorders. Particularly, they will help you distinguish between your autoimmune disorders versus other conditions. Okay, so now we will discuss about some conditions which are associated with your civet bodies, right? So the most common condition is your lichen planus. Okay, second would be lupus erythematosus, both the forms, cutaneous as well as systemic. Now point to note here is that not only these civet bodies are found whenever there is a oral lesion of such systemic disorders, but they are present throughout, right? So even if lichen planus the lesions are present over the hands or feet or any other part of the body for that matter, you can see the civet bodies under microscope, right? So this phenomena will be seen at each of the lesion, not particularly related to oral cavity but of the body as a whole. Then third is graft versus host disease, then erythema multiforme, dermomyositis, fixed rub eruption, bullous diseases, for that matter any kind of bullous disease whenever there is formation of bulla. Basically you can say that the bulla is getting formed because there is some or other kind of degeneration occurring at the level of basal keratinocytes, right? So in whichever disorders there is formation of bulla, you can see civet bodies under microscope such as bullous pemphigoid, etc., right? Then we have actinic variety of lichen planus, one which is triggered by exposure to the UV rays. Last would be lichenoid drug eruption. Now in case of lichenoid drug reaction, we have seen a slide previously. There you can appreciate apart from civet bodies, there is lymphocytic infiltration as well, right? So this is a distinguishing feature particularly for your lichenoid drug eruption, that apart from civet bodies, you can appreciate lymphocytic infiltration. So now let's move on to the conclusion. So your civet bodies are a hallmark of interface dermatitis. These are particularly found in immune mediated reactions such as in lichen planus, lupus erythematosus and any other type of autoimmune skin disorders. Their presence is basically indicative of keratinocytic apoptosis, particularly the basal keratinocytes, and this is due to immune mediated basal cell damage, right? Particularly your T cell mediated cytotoxicity. Now recognizing these civet bodies in histopathology helps in diagnosing situations or conditions such as lichen planus and other related disorders like glycanoid drug reaction. We have actinic variety of lichen planus as well. So all these type of autoimmune disorders you can easily differentiate between on the basis of your civet bodies. So these form a very important hallmark for differentiation of all types of autoimmune disorders, particularly when you compare them under immunofluorescence, right? So when you are doing direct or indirect immunofluorescence based on the pattern which is formed, from there you can differentiate other diseases also, like lichen planus versus bullous pemphigoid. But in both the cases you can appreciate your civet bodies, but the pattern in which they are formed, right? So that will help you differentiate between these two lesions. But civet body per se, you can say it is a landmark for your autoimmune disorders. So guys, that was all about civet bodies or colloid bodies. I hope you understood this topic very well. I will be back with a new video soon. Till then, this is Dr. Snehal signing off. Bye bye. Take care.